In this video, I want to be talking all things knee meniscus or knee cartilage. I want to talk about what these discs are, what a tear might mean, ultimately what it might not mean. And we're going to talk about things like stretching, strengthening, soft tissue work, and also potential surgery and whether that's actually required or not. So stay tuned. Lots of good stuff to bring you this way in this video. So first of all, my name's John. I'm a sports injury therapist. If you're new to the channel, it's great to have you. We want to help you understand your body, get rid of any pain and weakness, and strive forward and hit your health and well-being goals. But in this one, we're talking about meniscus and these discs here. So we have these two discs of cartilage sitting in our knee joint called our meniscus. Now, what's the role of these firstly? Well, they are our shock absorbers. You'll see by looking at this joint that we have two bone surfaces that go together but don't quite design to go together that well. So we have the rounded surface of the upper leg bone or the femur and the flat surface of this tibia. So in order to make those things be a little bit happier, we have these discs that allow our knee joints to rub over each other. That's the role of cartilage, to help things be nice and smooth. They also act as shock absorbers. We know that lots of force and movement goes through these knee joints. As we're walking, as we're running, as we're jumping, we're going to have lots of force. So these discs are there to act as our shock absorbers. Now, unfortunately, it can be common to develop a tear or pain in this. Now, firstly, how do we know? Well, we have a few little signs and symptoms that we might be looking for as therapists if we're seeing someone in clinic with knee pain. These might typically be things like locking or clicking, because again, if we know that these discs are there to make the surfaces rub nice and smooth on each other, if we start to see that sort of grinding sensation or clicking sensation, we know that perhaps there might be an issue with one of those discs. We also look for particular things like a locking of the knee. Again, it wants the joint to run smoothly. So if the joint isn't running smooth and actually locks, that might be pointing its way towards actually, is there a meniscus injury? We do have certain tests in clinic. As I said, this is a structure, designed to make everything run smoothly. So we try to provocate, or what we call a provocation test, recreate those movements to see if it runs smoothly. And we call this a Thessaly's test. Now, in this test, what we're looking to do is to stand and hold on to something, bend the knee to about 20 degrees, and then just looking to rotate almost from an 11 o'clock to 1 o'clock position. So what we're actually looking to do here is just bend there so the surfaces come into contact and rub. So as we rub those discs, is that a motion we're happy with? Again, if we're pain-free and we've got no injury in that area, then we should be happy with that. But if we get in pain in that area, then potentially that's telling us that we might have an issue in that area. So what do we want to do about this? Perhaps most importantly, so you might have been diagnosed with a meniscus injury. You might be suspecting you've got a meniscus injury. The key here really is all of these tests, it's difficult to diagnose because we're looking to provocate symptoms. There might be other things that get aggravated in that knee. So I would always firstly recommend something like an MRI or at least seeing a specialist to get a good diagnosis. But what does it mean? Well, when I first started out as a therapist, and we're now talking coming on a couple of decades ago, it was always felt, well, meniscus injury leads to a surgery. A surgery we now call an arthroscopy, a small surgery where we look to take away. So if we've got a damaged area in here, a surgeon will go in and clip or remove or tidy up that meniscus. Now, the good news about this is that it's a pretty good and successful surgery. We tend to expect patients to be back fighting fit in about 6 to 8 weeks following that surgery. So it isn't the end of the world. However, I truly believe when it comes to meniscus injuries, it should be our last port of call. There are things that we want to assess first. And what we know is the research is showing really good clinical outcomes. And our clinical experience is that we're getting good clinical outcomes, even with someone with a diagnosed meniscal tear, and actually they can be pain-free, symptom-free, and not have to have that surgery. So there's three things that in particular we want to be assessing. We want to look at the flexibility of the structures that cross the knee joint. We want to look at the strength of the things that control our lower limb instability, and that's our glutes. And we also want to look at the tissue quality. Are we developing things like trigger points in the muscles that cross that knee that could be contributing to it? So what I'm going to do now is quickly flick through ways that you can be checking yourself out at home to see if you can make any improvements in any of these three areas. So firstly, let's talk about flexibility. So three things we want to check out. Flexibility of the quads, first of all. The quads are the muscles that come down and cross the front of the knee. How do we check out flexibility? Well, we look to lay on our front and we pull our foot up towards the bottom. You should be able to grab your foot, pull that in and be able to get that foot to touch your bottom. If you can't, that's an indication we're a little bit tight in that area. And that's something that we might want to improve on. So if you find the legs away, or even you can't grab that ankle because of that quad tightness, there's an indicator. The good thing, what do we do about that? Well, that test in itself can become a stretch, because what we want to do here is just lay down and bring that foot up and hold that stretch. Now, if you find you can't quite get that, we can cheat on this a little bit by laying on our side, bringing the leg up, pulling the foot back and just holding where we can, holding that stretch for 30 seconds. Following that, what we can look to do is to go into a hamstring stretch. So here what we're looking to do to test our hamstring is laying flat on our back and looking to bring our leg up to straight. Importantly, you want to keep this leg side, you're not testing flat, you want to keep this knee straight. What we see a lot of people do is bend that knee, and that's cheating a little bit, taking the hamstrings off. You want to try and get this leg as close to 90 degrees. I'm a little bit tight in my hamstrings, but if you find that the leg's way away from that, again, that's an indicator that we can improve on that flexibility. So all we can look to do as a stretch is look to just hold the position we can get to for 30 seconds, not jamming it, not getting pain, just hold it gently for 30 seconds. Even if we're repeating 2 or 3 times that stretch, we'll find that benefit. The other area that we want to check flexibility out of is the glutes. We can do this by bending one leg on top of the other leg and lifting. Now, on this one, I'm testing my left-hand side, but my indicator is where I get this right leg to. Can I get this to 90 degrees? If so, flexibility for the glutes quite good. If I'm struggling or my leg wants to push back, that's telling me that that's tight. And like with the other tests, we can then, if we find that, use this as a test, hold that position and just hold that for 30 seconds. Now, with our stretching, these are things that we can be doing every day. Holding those stretches every day, repeating those 2 or 3 times a day for 30 seconds on each one. Now, moving on, I mentioned that we want to check out the stability of our glutes. Our glutes wrap around the hip and they really control all of that lower limb stability. So if we've got good control of that knee, we're going to get less movement at the knee and less problems related to that sideways movement. Whereas if I've got poor glute control, and then what I start to find is my knees rotating all over the place, then what we're going to be getting here is we're going to get some excessive force happening at the knee, and that's not going to be great for our meniscus symptoms. So how can we check this out? Well, firstly, looking at exercises like squat, where we're looking just to drop into a squat, can we control that knee position, or does the knee start to drop in? That's an indicator that we've not got the glute control that would be ideal. Can you repeat on the single leg, particularly on that problematic side? Can we keep that knee from dropping in and imagine that knee going straight up and down? Or does it start to wobble or drop in? Again, that's an indicator that we've not quite got the glute control that we want. How can we improve that glute control? What I'm going to give you now is just a quick circuit of exercises to isolate those glute exercises, to really give them a good glute workout. We're looking to do each exercise 6 reps on each side, 3 sets on each one. So this is what I call our glute activation circuit. Now we kick off with an exercise called the clown. Now, what we're looking to do in a clown is just lay on our side, put one leg on top of the other, knees together, and we're just looking to bring one leg away and then slowly lower it down. You'll see on all the exercises, the slower we lower down on the way down, the better the glute workout. And you can actually put your finger into your glute and feel those glute working. 6 on each side, repeat on the other side, 3 sets. Then with the exercise becomes a bit harder by just taking our legs straight. Turn that top leg out and just bring that one up. Again, slow on the way down and feel that glute control. On the way back up, slow on the way back down. 6 on each side. Then the final exercise, going into what I crudely call the weeing dog exercise, is we look to just place our knees shoulder width apart, hands beneath those shoulders, and you just look to bring one leg out and again slow on the way down. And you'll really feel by the end of this circuit, this really targeting those glute muscles. Once over time, if we're repeating those exercises every other day, so a slight change to the stretching program. Stretching we can do multiple times every day. These exercises I just recommend doing every other day, 1 set where you're doing each exercise 3 times for the 6 reps. But you'll feel those glutes start to become stronger, and that's going to be giving you better stability of those knees. Then the final thing I mentioned is that we want to make sure the tissue quality, the muscles that are affecting those knees, so the glutes, the hamstring, the glutes, the hamstrings or the quads, that we've not developed any of these trigger points. So this is where we bring in things like our massage guns, our foam rollers, our trigger balls. These are all great. These are all things, again, I recommend doing every other day, but applying these into the tissue. So if we're using one of these tools, first of all, like a foam roller or a ball, what we look to do is lay onto the ball or the roller and just look to roll through that tissue. Find a sore area, hold on that area, 30 seconds to a minute, let that tissue relax and then move on. And you can repeat that on both legs, trying to pick out those sore points. Again, if I change to using the ball, we can look, if I was doing my hamstrings, place that under my hamstring and look to just roll through that tissue, trying to find those sore points, those bits that create that painful response. Just hold on that for 30 seconds to a minute and then carry on. Then, as I said, utilizing something like a massage gun can be really helpful. So this is great. I always like these because it's something that can be done in front of the TV, but just looking to work into that tissue. Again, once we find that sore point, linger on that sore point and look to release out that tissue. So whichever way you like to perform some self-massage, I think it's a really important task. Looking at all of these muscles that we know are coming down and crossing this knee, can we find the sore points and just spend 2 to 5 minutes on each side trying to release out those sore points. Release out that tissue, less pressure coming across the knee, less force being applied, less shock absorption needing to happen, less pressure on the meniscus. So they are my 3 things that when I'm working with somebody in clinic, we really want to make sure we can achieve all of those things. Good flexibility, good glute control and overall knee stability, and good tissue quality through that area. So I hope that's been helpful for you. Just to reiterate, stretching are things that we can be doing every day. Self-massage and the glute control strengthening work, I'd be doing it every other day. And then monitoring your symptoms. Is that starting to settle down? Are we starting to make those improvements? As I said at the start of the video, one thing I would always do though is look to get these things checked out. Get a good diagnosis, potentially an MRI scan, so that you can have a good personalized rehabilitation program for you to help you strive towards those goals of being pain-free. And as I said, if the last resort being surgery is required, for me, it's still not a negative because it's a surgery that we always see people overcome from and come back strongly from. But I also support with my clinical research, and our team here's clinical research, some of the academic research that we're seeing, that perhaps we don't need to dive to surgery straight away. Check out these other things, improve the overall structures around the knee, and we just might get the results we want. I hope that's been helpful for you. If it has, you can do me a favor, especially if you made it this far through the video, smash that like button, and also why not subscribe? Here we want to be giving you the tips that we're giving our patients in clinic. So subscribe to the channel. We'll keep you updated on all our health and wellbeing tips, and we'll see you on the next video. See you then.